Hey everyone, it's Dr. Prabakar from TheFibroidDoc, and today we're going to talk about anemia. So what is anemia? Anemia is it's a medical state where you have a low hemoglobin. What is hemoglobin? Hemoglobin is a protein that is found on your red blood cells, and the job of hemoglobin is to carry oxygen from your lungs to, everywhere else in your body, to your brain, to your heart, to all, your legs, your toes, everything. And when you have low hemoglobin, that means you don't have the capacity to carry oxygen as well. And that means you start to feel tired, you start to feel lightheaded sometimes, very, very fatigued, maybe dizzy even. Your heart may start to beat fast in order to make up for the lack of oxygen. These are the common symptoms of anemia. And why do we get anemic? There are many reasons why someone may be anemic. There are genetic reasons as well, but in my world, the most common reason is blood loss. So you could be bleeding from heavy fibroids. You could be bleeding heavily from fibroids, or maybe some polyps, or maybe some other hormonal issues. So these could all be causing heavy bleeding. And so you're losing blood, you're losing hemoglobin, you're losing iron, and you're losing the capacity to replenish your body with lots of oxygen. So patients who are anemic start to feel very tired, fatigued, lightheaded. And if this is happening on a regular basis, you may actually be used to it. So for you, you're like, oh yeah, my hemoglobin is 6 or 7 and I'm feeling fine. But fine is not as well as you could actually be feeling. The normal hemoglobin level is about 12 to 13. So if you get a blood test and you notice that your number is below that, you definitely want to talk to your doctor and find out why. I think the lowest I've seen is about 5, which was pretty scary to me. But the patient, because she's bled so much and she kind of lives at a level of 5 to 6, was doing pretty well. But this is very scary because you don't give your body a reserve. So suddenly you have a heavy bleed and then you get down to, 4 or 3. Well, that can definitely be life-threatening. So what do you do if you are anemic? So if you are losing blood every month, from your periods and from heavy bleeding, you definitely want to replenish the iron in your body so you can start to get back to, carrying around good oxygen. So this can be done by oral supplements of iron. When you do that, sometimes it can constipate you, so make sure you take some Colase or some stool softener, and also vitamin C in order to help absorb that iron. You can also get IV iron, which is literally, they put an IV in your arm, they drip iron through a bag, and it goes into your veins. And so it's a quick boost and a quick way to replenish the iron instead of slowly waiting for oral iron to do its job, which may take several weeks. And of course, if it's very dire and very urgent, you may actually need a blood transfusion for life-threatening purposes. So just wanted to talk about that a little bit. And, if they can't quite figure out why you're anemic, maybe you're bleeding, but you are taking iron, you are taking the IV iron, you did get blood and still, it's just not going up. Or you just need IV iron and you need to be referred to a specialist. That specialist is called a hematologist. A hematologist is a type of doctor that specializes in blood. And so they may, see you, draw some blood levels, and actually then give you the IV iron. And if it's not very obvious as to why you're anemic, they may do some additional tests to see what's going on. So I talk about anemia a lot to my patients, so I figured I'll just make a quick video on it. Let me know if you have any questions. Bye.